Welcome to the Deep Dive. Today, well, we're tackling some pretty fresh news, actually. It's potentially got big implications across the health insurance world, specifically around Medicare Advantage plans.
That's right. We're looking at excerpts from a CNBC piece that just dropped this morning, April 17th, 2025.
Exactly. And our mission here really is to understand why a giant like UnitedHealth Group just revised its profit forecast downwards. And, what could that mean for us, for the system?
And the headline is certainly an attention grabber. UnitedHealth stock dropping, 20%?
A full 20% plunge, yeah, after they cut their annual profit forecast. The reason? Unexpectedly high medical costs in those Medicare Advantage plans.
Wow. Yeah, 20% for a company that size. That's not just noise. That signals something significant is happening in the market.
Absolutely. So let's unpack it. The basic story. UnitedHealth expects lower profits because their privately run Medicare plans are costing more than planned. Simple as that. On the surface.
But it's rarely that simple, is it?
No, exactly. Yeah. And the CNBC article points out Wall Street sees UnitedHealth as a kind of bellwether, right. A signal for the whole insurance industry.
Right. Where they go, others often follow, or at least it shows the pressures everyone might be facing.
And this isn't happening in a vacuum either. The article mentions 2024 was already, let's say, turbulent for insurers. Yeah. Lower government payments, rising medical costs generally, and that awful situation, the public backlash after the death of that United Healthcare executive. It's been a tough stretch.
Definitely sets a context. And UnitedHealthcare, well, they're the biggest provider of these Medicare Advantage plans in the U.S., right?
They are the largest. So these plans, just to remind everyone, are the private insurance alternatives to the traditional government-run Medicare.
So when the biggest fish in that pond says costs are unexpectedly high,
it sends ripples everywhere.
Yeah.
And we saw that almost instantly in the stock market reaction for competitors.
Right. You mentioned the drop for UnitedHealth, but Humana fell 5%. Elevance Health was down over 1%. CVS dipped 2%. All players in the Medicare Advantage space.
Exactly. But interestingly, Cigna, which doesn't have Medicare Advantage business, their stock actually went up nearly 1%.
That really tells a story, doesn't it? It isolates the concern very clearly to that specific market segment, Medicare Advantage.
Yeah, it does. Now, there's this TD Cowen analyst, Ryan Langston. He had some pretty strong words. He said UnitedHealth's Q1 results showed ominous signs.
Ominous signs. Yeah, you don't usually hear analysts use language quite that stark unless they're really concerned.
So what's got him so worried? What's the basis for that ominous?
Well, Langston's point is that UnitedHealth had actually sort of foreshadowed rising medical costs back in 2023. They indicated they expected costs to go up.
Oh, okay.
So the fact that they're now sounding the alarm even louder, according to Langston's take, makes it particularly concerning. It suggests maybe even their own earlier somewhat cautious predictions were way off base.
Like maybe they underestimated just how much costs would climb?
That seems to be the implication, yeah.
Yeah.
It raises questions about the outlook for basically all insurers in that space.
So what are the underlying reasons? Why are costs suddenly so much higher than expected, especially for a company like UnitedHealthcare that you'd think has tons of data and models for this stuff?
Well, the article touches on a general trend we've kind of seen building across the industry over the past year or so.
Okay.
More seniors seem to be going back for procedures they might have put off during the pandemic. Things like joint replacements, hip replacements, elective but necessary surgeries.
The deferred care catching up. Makes sense.
Exactly. That demand didn't just disappear, it was just delayed. But what's surprising here that the article notes is that this particular surge hadn't seemed to hit UnitedHealthcare quite as hard before.
So while the trend was there, maybe they thought they had a better handle on it, or it wasn't impacting their specific member base as much until now.
Perhaps. That's what makes this announcement a bit of a surprise, coming from them specifically.
Okay, but I imagine this isn't hitting every single insurance company in exactly the same way.
That's a crucial point. Andrew Mauck, an analyst at Barclays, brings this up. He suggests the hit might actually be less significant for some companies.
Oh, like who?
Like Humana and CVS. Because, apparently, they've already made what Mauck calls significant exits from certain Medicare Advantage markets.
Why would they do that?
Because those specific markets were already becoming unprofitable due to, you guessed it, higher costs and also lower government reimbursements in those areas. So they were kind of proactively trimming the fat, if you will.
Got it. So they saw the writing on the wall in some places and got out ahead of it. Smart move, maybe.
Potentially, yeah. It seems they anticipated some of these pressures in certain segments.
But what about the flip side? Companies that maybe leaned into Medicare Advantage trying to grow their share.
Well, according to Rock, those companies could be facing a bigger challenge now. He mentions UnitedHealth and Alignment Health as examples of insurers that have been actively increasing their market share.
So they might be more exposed now that these cost headwinds are really picking up steam.
That's the logic, yes.
Yeah.
They have a larger presence in a market that's suddenly looking a lot tougher financially.
Okay, let's get specific about what UnitedHealth itself is seeing. What did they actually say happened in Q1?
They reported that the use of medical services, they call it utilization in their Medicare Advantage business, shot up way past what they had projected for 2025.
And those projections were based on?
Based on what they saw happening in 2024. But something changed, especially towards the end of the first quarter this year.
How much did it change by?
This is the striking part. The CEO, Andrew Whitty, said care activity increased at twice the rate they had anticipated.
Twice? Wow. Okay, that's not a small miss. That's significant.
Yeah, twice is a big number when you're talking about projections at this scale.
And where did they see the biggest jumps? Was it hospital stays, emergencies?
Interestingly, no. Whitty highlighted that the increase was particularly noticeable in visits to doctors and in outpatient services.
So, care that doesn't involve an overnight hospital stay.
Exactly. Think routine checkups, specialist visits, diagnostic tests, minor procedures done outside a hospital setting, maybe more frequent follow-ups, too.
Now, another analyst, Lance Wilkes from Bernstein, found this whole thing really surprising.
Especially given that care activity levels were already pretty high over the last year, right? It wasn't like things were quiet before this.
Right. So what's his theory? Why the sudden extra surge if things were already busy?
Wilkes floats a really interesting idea. He suggests that maybe UnitedHealth, and possibly the industry more broadly, are dialing back the intensity of their utilization management.
Utilization management. That's things like prior authorizations, right? Getting approval before you get a test or procedure.
Exactly. Those processes insurers use to try and ensure care is necessary and appropriate. Wilkes wonders if maybe they're being less strict with those controls.
And why would they do that?
Well, he points to policy headwinds and increased scrutiny. There's been a lot of pushback against things like prior authorization denials politically and from patients and doctors.
So the theory is maybe they're loosening the reins a bit due to that pressure, and that's leading to more services being used.
That's the potential connection he's drawing, yes. It's a plausible hypothesis.
He also mentioned a couple of other sensitive factors.
He did. He suggested, perhaps cautiously, that the tragic death of Brian Thompson last year and also the ongoing Department of Justice scrutiny into UnitedHealth's Medicare billing practices. Maybe those things are also making the company more hesitant to push back on care requests.
Right. Sort of a chilling effect, maybe. Makes sense that could be a factor. It sounds like a really complex mix of things.
Definitely not just one simple cause. And the article adds another layer, too, issues within UnitedHealth's Optum unit.
Optum. That's their health services arm. Includes the pharmacy benefit manager, doctors groups, all sorts of things. What's going on there?
UnitedHealth mentioned changes in the sort of patient profile, the characteristics of the patients being served by Optum. They didn't elaborate much in the snippet we have, but it was flagged as another contributing factor.
Okay. So multiple moving parts. Is the company just throwing up its hands, or do they have a plan?
No. CEO Whitty stated they are taking action. He described both the Optum issues and the elevated medical cost as highly addressable looking towards 2026.
Highly addressable. That sounds cautiously optimistic, like they think they can fix it.
That's the message they're putting out, yes. Expressing confidence they can get these things under control over the next year or so.
Okay. And amidst all this cost pressure, is there any potential good news or relief coming for these insurers?
Actually, yes. The article does mention one potentially positive development on the horizon.
What's that?
The Trump administration recently announced an increase in the reimbursement rates for Medicare Advantage plans for next year.
So the government payments they receive per member might go up.
Exactly. And apparently this increase is quite a bit larger than an earlier proposal from the Biden administration. So that could provide a welcome financial boost next year.
Something to help offset these rising costs, potentially.
Could be. Yeah, it might cushion the blow somewhat.
Okay, so let's try and wrap this up. For you listening, the big takeaway here really seems to be that UnitedHealth's announcement, this profit warning, it really spotlights these potential headwinds from rising medical costs in Medicare Advantage.
And because UnitedHealth is such a huge player, what affects them often signals broader issues for the whole insurance industry and, down the line, potentially for the healthcare costs we all face.
Definitely something to watch. And it's crucial, as you said, to remember this is still unfolding.
Absolutely. Analysts are looking at it from different angles. The impact won't be uniform across all companies. It's a developing story.
It really is. So maybe the final thought to leave you with is this. Considering these rising costs and these potential shifts in how insurers, manage care, maybe being less intense with utilization management, for instance.
What questions does that raise for you about the future? About your own healthcare coverage, your access to care? How might these big industry shifts affect your experience down the road?
Yeah, that's the key question, isn't it? Definitely something worth mulling over as we see how this plays out.
Indeed. Well, thanks for taking this deep dive with us today.